Hi, everybody. Good morning or afternoon, depending on where you may be joining us. My name is Matt, and I just want to say thanks for taking the time today to be with us. We hope that you find today's session valuable. So, a little bit about our presenters today. If this is your first Provider Trust webinar, this is Mike Rosen, our co-founder here on the left. Mike has 30 plus years in the compliance in doing compliance work. He's also a lawyer in the past and has provided counsel to some large organizations here in Nashville, Tennessee, and others. And there you will see Donna Thiel, our Chief Compliance Officer, who has 30 plus years experience in compliance at one of the nation's largest long-term care facilities. And she also has a lot of experience working with HR professionals as well. So she is perfect for today's topic, aligning HR and compliance during COVID-19. So a little bit about us. We are here in Nashville, Tennessee. We are a software as a service company. We partner with healthcare organizations here in Tennessee and across the nation to really improve the efficiencies of their processes on the HR and compliance side. So we do believe that a smarter healthcare makes a safer healthcare at Provider Trust, and we live this out by monitoring healthcare populations to identify compliance and credential issues before they impact patients. So before we start, I just want to say to everyone on the call today, thank you. We are so grateful for you and the work that you do every day to support the front lines, and we know that you have new responsibilities and a new routine in a new place, just like all of us. And we just want you to know that we are here to help in any way. We realize this situation is uncomfortable, and we are happy to support you. So please just don't hesitate to let us know. We're proud to partner with you guys and are just here to help. So if you need us, please let us know. Before we get into today's agenda, I want to share some resources that we have that we've come up with over the past couple weeks that will be helpful to you today. And this afternoon, we'll actually share links to all these resources so you can access them easily. But firstly, I'd like to cover our no-cost license verifications offer. So we are offering no-cost license verifications to medical volunteer screening support for healthcare organizations. So if you have a large group of volunteers that has recently come to your organization, we want to help you get those volunteers working as quickly as possible. It's a very easy process, and I will link this offer in our follow-up this afternoon. But that is something we're very happy to offer and support, and some folks have already taken advantage of that. So please reach out if that's of interest to you. Secondly, we have aggregated all of the latest information on state medical board waivers and license portability, all in one page. So we've gotten all of the state and federal resources together, so it's very easy for you to scroll and access specifically the directives from your state, and also see those federal regulations that have been released. And I will also share this link this afternoon. And then finally, I'd like to cover our VendorProof marketplace. For those that are not familiar, VendorProof is a directory of compliant vendors that have been screened at the organizational and ownership level. And we've reached out to thousands of folks that are on our VendorProof marketplace, asking them to update their profiles with PPE that's available. So we're trying to link those in need with those that have it, and it's very easily done through the VendorProof marketplace. So we're excited to show you those vendors that have updated those profiles and give you just one easy place to find PPE if you need it. So again, that will be shared in the follow-up this afternoon. So today's agenda, we'll start off with Donna covering managing communication and expectations. Then we'll move into staffing and adaptability, and then into provider safety and support, and then finally a phased approach. So please be on the lookout this afternoon for that follow-up email. Take advantage of those offers that could be helpful to you. And we also have a survey after the webinar so that we can be sure to bring you relevant and valuable information that you are interested in hearing about. So please just stick around for a few minutes after the webinar. You'll be prompted to fill out a survey, and we would greatly appreciate that if you could take that time. So with that, I will pass over to Donna to cover managing communications and expectations. But right before she does that, we will have our first poll of the day. We have two. So we're curious how your meetings are going or how often you're communicating with your clinical staff. So I know at Provider Trust, we're having daily meetings and just to align and make sure that we're all on the same page constantly. So we're curious of how that's working for you. If that's daily as well, if it's a couple times a week, once a week, or every other week, and even if there's no specific schedule there, just fill that in and we'll share what your peers have said. So we'll leave that open for just a few more seconds. And share the results. So the majority of you guys are meeting daily. That's great. Donna's going to cover how important that communication is, and hopefully we can get the others to meet that expectation and start to. I know that it's not always easy to get everyone in one place at one time, and we know that a lot of you guys are doing what you can when you can, and that's very understandable. But thanks for filling out our poll. We have another one later on in the presentation. And with that, I will pass it over to Donna.
Thanks, Matt, and welcome everyone. As Matt said, we're so appreciative of all that you do. We know how crazy busy you are in this, especially right now as we're all trying to manage the myriad of changes that are coming about. So thanks for taking a little bit of time today to spend it with Matt, Mike, and I. So as the first poll just talked about, communication is so essential in these times. We talk about what a comfortable cadence is for your teams, and it looks like the majority of you, or at least half of you, are doing it daily. Some 2% said, every other week. I'm sure that most of us are feeling that more frequent communication is comforting to many folks. Talking about some simple ways to deliver messages. Are you doing stand-ups at the beginning of the day? Or if you're in a healthcare setting in a hospital or a nursing facility, are you doing stand-ups at shift change, just so that we're understanding the patients that are coming in, the change in condition that we're seeing? Are we communicating daily? Are we sending out maybe emails to folks just with some words of encouragement? Certainly, I'm sure all of us have COVID teams that are meeting on a routine cadence, trying to determine what our next steps are as an organization, and how are those COVID teams providing updates to the general staff. Really trying to connect with each person to their individual roles. I worked with someone many years ago who always used the term with me as we were preparing training of what matters to me. And I've really tried to use that as we prepare training and thinking about, as I'm communicating, how to make sure that the message relates to the people that I'm talking to. So how are you really making sure that the messages that you're sending out relate to the individuals and are clear as to what their expectations are? Also, in this time of need, trying to be encouraging and positive, reminding folks that there really is hope, that the roles that they're playing are so important to the future of the organization. How are you incorporating some positives into your messaging? And then last but certainly not least, helping them and reminding them of the resources that you have within your organization should they need some personal attention and really meeting their personal needs. You'll see on the left side that we've also put together some resources. Everything in this presentation will be sent out later today from Matt, along with the recording. So you can use these links to get to some other resources as well. Let's go on to the next slide and talk a little bit about coordination. As much as communication is essential, coordination is as well. Certainly your COVID team, making sure that, it's whether it's senior leadership, whether it's leadership from each of the different disciplines within your within your team, just understanding kind of who makes up that team. When we talk about compliance and the role of compliance in these times, we know that we are continuing to see modification to rules and regulations. CMS comes out with changes, CDC comes out with new recommendations. How are we really managing those? And is compliance helping coordinate those messages and then working with HR and operations and your COVID team to communicate those changes? Who's tracking all of these changes? We've seen the OIG come out with a message that says, hey, we're really good at tracking the regulatory changes so that when we come back down the road and we're auditing you, we will remember that during this particular time, this billing rule was changed or this process was lessened. But do you and will you in your organization? So I think it's really important to make sure that as you're making decisions that you are purposefully tracking the changes that you've made to your own policies, and even if they're short-term policies, what are the date frames that you've used to allow these changes? What's the evidence of the decisions that you've made? What resources are you linking to, whether it's an OIG, whether it's CMS, whether it's state changes? Where are you documenting those decisions? Because again, at some point in time, we all know whether it's a regulatory oversight, whether it's a lawsuit, whatever it might be, someone's going to come back and challenge us as to why we made the decisions that we did during this point in time. So I think really important for the compliance folks to continue in what was probably their normal course of action, but really monitoring and tracking those decisions. Our human resources folks, many people on our team now are working outside of roles that they're not normally working in. So are we clear, or are employees clear, our team members clear in what the responsibilities or the expectations are of those new roles? So again, making sure that we're talking to the people as to what matters most to them and how they can do their job. We added clinical here, and really just it goes without saying what an important role all of our clinicians are playing, but how are you really helping this team and thinking as you are putting your coordination and your time and energies into it, what are we doing explicitly to help our clinical team? In the next slide, some of you who are routine members, if you will, of the Provider Trust webinar series will remember Dr. McCary spoke to us about a month ago now, and we had a wonderful session. That session is recorded, and the resources that Matt is going to share with you later today, you'll be able to listen to that again. But one of the areas that he talked about were establishing the COVID teams, and he didn't just talk about the COVID team of today, which is kind of what this slide is talking about, but really what does the COVID team look like in the second wave or the third wave? So I encourage you to think about, as you're looking at the team members you have in place today, we're kind of well into COVID response right now, but what are we going to what are we going to look like a month from now? What are we going to look like 6 months from now? And evaluating our team members and trying to figure out, are they first string? Are they second string? Are they third string? And how is this going to look and feel as we continue to evolve through the management of COVID? So now let's talk a little bit about HR and compliance collaboration. Some of you, again, who have joined us in previous webinars, we've talked a lot about HR and compliance and collaboration. And usually when we talk about it, we talk about how the two teams kind of join the responsibilities, or they have overlapping responsibilities. Today, we changed this a little bit and put our clinicians or our clinical operations kind of in that middle. And this particular slide, we're speaking to what I would consider the high volume, or the health systems that are dealing with high volumes of COVID patients, as opposed to some of the health systems that we're going to talk about in the next slide, which maybe are dealing with some different challenges. So in this particular scenario, our HR folks are continuing to coordinate with those practitioners that maybe aren't in their direct employee group, right? They're bringing in, as Matt described, as volunteers or people, resources from other groups. They're trying to find those folks. They're coordinating, getting them on different shifts or into different hospitals or different units within the hospitals. They're trying to manage that credentialing process of making sure that they're properly licensed. Do they fall within one of the exceptions so that they can practice within our health system, and trying to get them onboarded appropriately, and really just doing health screening of all of our employees on a routine basis to make sure that they're healthy to continue to take care of our patients. At the same time, compliance is on the far right. Again, managing those regulatory updates, trying to make sure that they're communicating any changes, supporting through the hotline any of our team members who are frustrated or who need help, depending on the way your hotlines are managed. Maybe it's families that are calling. All of that continues to happen. Well, right in the middle, we have our clinical operations who are saying, hey, we need more staff. We need more PPEs. How are we training my interim staff? What are the rules for testing my staff each day? And just making sure that both of these two teams are really helping and supporting the clinicians and the clinical operations as the world is changing, and as just the census is changing, and the resident populations or the patient populations are changing within that health system. Let's look at the other perspective of this. So we know today there's kind of three, I would say, three populations, if you will, that are managing in the COVID world, right? One is that high impact health system. One are the low impact health systems, the ones where they haven't seen surge, they haven't seen a high incidence of COVID. And then we have another whole population, which are our management teams, our corporate offices, our vendors who are supporting, who are really working in a remote environment, and they have a whole nother set of challenges as well. So this slide, we talk about those health systems maybe in our rural settings where they haven't had the high incidence of COVID, where HR is now really looking at helping support decisions about employment. How are we making those changes? Do we have to furlough our employees? Do we have to do pay cuts? What sort of shift changes are we making? Are we having everybody work, 3 days a week instead of 5 days a week? How am I really managing that communication? Monitoring staffing minimums. Many of our post-acute providers, other states have staffing minimums. So how am I monitoring that and making sure that we're still meeting some of those state and federal requirements? Compliance, I think, is kind of doing the same sort of thing that they were doing with the high volume systems. Again, making sure that those changes are being communicated. But our clinical operations now are in the middle saying, wow, we don't have the same patient populations that we had before. Help me figure out how to modify my schedules. Do I have to lay off my employees? Can my staff go work for other providers, right? So if I don't have enough to keep all of my staff working today, can I allow them to go work for a health system that has a higher need? And what does that mean when they come back into my organization from a health screening? So all of that coordination and collaboration is just essential. So I'm going to turn it over to Mike now, and he's going to walk through some staffing and adaptability.
Okay, well, good morning or good afternoon, healthcare heroes. And for those of you on the HR side, you're just as much a hero as a clinician, because you've got a lion's share of things that occur to be compliant and have to go forward even in difficult times. We know that you're struggling, and that at this point you have all kinds of new things thrown at you, just as the frontline caregivers do, and they're relying upon you and the continuation of what you do, or the betterment of what you do, to help make their jobs easier. That can start with staffing requirements. They're probably, with over 150 people on the call here today, a variety of different needs on this call. Some have had to reduce staff, and some may have actually had to increase staff. You also have people that showed up at your door in hotspot areas that are from another state with a license in that state, who want to help. And now that falls upon suddenly HR or credentialing to figure out how to get them vetted and into the workplace as fast as possible as a volunteer. So we recognize that, and if you haven't experienced these, you may very well, as unfortunately a second wave may be coming later in the season in the fall, with surge capacity and flexibility, and how do you plan for those things? So this comes at a time in which you may also, because of short staff, administrative people in your organization, you may also be asked to help find equipment, PPE, for your providers. And so you're probably entering new areas that you're not familiar with, and for that we want to both, thank you as well as encourage you to be resourceful. We know that that comes with cost reductions in administrative, and probably some of your own teams have been furloughed, which puts more burden upon yourself, creates bottlenecks when it comes to credentialing. Hopefully the resources that we're providing to you here and the links to the state board waivers and the law requirements allowing extension of license renewals past their deadline through September, it appears in most states at this point, is helpful to take that burden off of you, and you can rely on those things. So we know that that's what you're facing. Now let's move to the next slide and talk about patient decreases, the financial impact that has. We recognize, and there are now lots of reports beginning to come in about the economic hardship that you're facing, that you're taking a toll on your cash flow, on operations, and that you've been put under a lot of stress, yet you got to keep performing. The American Hospital Association actually had an interesting quote saying that the Emergency Relief Fund in the CARES Act was intended to provide hospitals with an infusion of emergency relief as providers incur substantial expenses and loss of revenue in preparing to fight for COVID. You can have your own comment as to whether that's actually been helpful, but look at some of what we found here that substantiates and is relevant to what you're having to be faced with. According to Ppe Standards, they did a survey of over 160 physicians across multiple specialties and found that patient volumes are down. If it's non-essential for the time being, most states are restricting that from happening. That's going to take a big impact on revenue that you were otherwise intending. I've seen some reports that in Tennessee, across the board, hospitals are losing $1 billion a month in total because of this, and we're a small state with only 6 million people. That creates staffing challenges, which where's the revenue going to come to pay for this? You've got reduced hours, furloughed employees, layoffs. What do you do when they want to come back? Do you have contracts in place to bring in temporary workforce, or are you scrambling to get them in place because they weren't there? Recognizing that those are all challenges, hopefully, from what you learn here and or already had in place, you already have some mechanisms that you can flip the switch in this type of emergency, take advantage of some planning that you may have done in advance. If you haven't, now's the chance to document what you're doing so that when or if, God forbid, this happens again, you're not scrambling to figure out what you did to solve it. And you can look at this other report from Kaufman Hall in March, fairly relevant as far as timeliness. Today, everything changes on a daily basis. But they looked at over 800 hospitals and found that on average, margins are dropping significantly. And so how are you going to move forward in these new turbulent times? So I think that, Matt, if we'll next go to a polling question.
Yes, just to go off what Mike was saying here, this is our second and last polling question, but we are curious as to what your biggest staffing challenge is responding to COVID-19. And we know there's been a lot of uncomfortability around this, a lot of difficult decisions that you guys have been making, and we're just curious so that we can share with your peers. One, so we can get a good gauge of what everyone's experiencing, and two, just so we can be in solidarity a little bit, knowing that everyone is really facing these hard decisions right now. So we'll leave that open for a few more seconds. And we will close and share.
All right,
So
Matt, I'll address this.
Yeah, go
If
ahead.
you don't
Mike.
mind. This is no surprise. It's all over the board, and I bet most of you had a hard time picking just one, which would affect these numbers also. But a third of you had to deal with furloughs and layoffs. Resources are obviously an issue across the board, and then changing roles, telehealth. But what a role that's going to play. That's the business you need to make sure you're either in or getting more familiar with to survive in the new post-COVID world. In the interest of time, let's go to the changing roles that we see happening and new demands. It's going to cause significant changes in healthcare. We all know that. You're in the midst of watching it evolve live. Telehealth and telemedicine. If you're not familiar with it or haven't embraced it, now's the time. It is going to be the wave of the future. There are going to be all kinds of new regulations, new rules about that. There's also going to be new regulations and responsibilities for treatment and what kind of PPE are you providing? Is it sufficient for everyone? Nurse practitioners, physician assistants, only going to get more relevant. Respiratory therapists, boy, if this is the time to tell your kid in college what they should study, this is one that I would recommend. But it's going to bring a lot of attention to some of the new specialties that maybe in the past were part of your workforce but didn't have such a significant role. And again, volunteers, what happens when they show up or they want to help? Healthcare people by nature want to help, but you've got to make sure that you don't just blatantly allow someone in or blindly into your organization without vetting them. And so that causes, that's going to be a new challenge for you. Are you preparing for the surge, right? If you haven't already seen it in a hotspot, you can only anticipate that it's likely to happen in the future. How far removed are you from the daily operations and able to do so if you're working remotely? That's a challenge for sure. Still a responsibility, and understanding how maybe staffing will look to change in the future to uphold this new surge that we can all expect. And what is the new normal? I think the new normal changes on a daily basis, so not an area that you can rest on your laurels. And I would encourage you to subscribe, read, learn from blogs, pay attention to what the trade associations are saying as this continues to evolve. Matt, next slide, please. All right, Don, I'm going to turn it back over to you for provider safety and support.
Okay.
Oh, actually, I believe this is mine. I apologize. Keep going.
It's all good.
The beauty of working remote. Matt, all right, so this is regarding the PPE standards and safety. We talk about at Provider Trust, a smarter healthcare makes a safer healthcare, and safety is a huge component in the role that you play in HR. 67% of the providers and clinicians feel that the supply chain isn't happening well. This is from Cardinal Health. They're big in this. I think we're seeing that, and we're all having to figure out where are we going to get the equipment that we need. You have it, on an exponential basis because you're on the front lines. But think about all of your vendors that support you. That, like at Provider Trust, we are going to have the right kind of masks and Purell stations and things so that we can get back to work and be present to be able to support even you on the front line. So this is a big condition. Lack of essential equipment is probably the biggest pain point if you asked a provider today. They're they're scared, they're tired, and they're frustrated, not at you, but with the fact that it's hard to find the materials that they need. So again, here's a free place for you to look and find vendors that we have vetted in the healthcare sector that we can vouch are legitimate, providing services. They're not excluded either as owners or at the company, and you can look to see if they're in your region and area to help supply you in that area. Next slide, please. No doubt that you're familiar with the fact that people are taking advantage of because of supply and demand, and price are increasing. I'll leave this for you to commiserate over. This doesn't make it easier for anyone, but certainly a fact that it's going to cost more to get what you need. So let's talk about how we support you, how you are important in supporting healthcare as a hero, because you are. You probably didn't ever think or hold your head high that HR is a hero and part of this, but you're so integral into this. You know, there's mental health issues that you yourself and your frontline workers and anyone that's scared to come back to work, they're dealing with, and finding the right resources and making sure that employee assistance programs through your benefit program are being, you know, communicated and used are things you can be doing. Psychological safety. You know, one of the key components of trust is psychological safety and delegation. Well, if your staff feel that you're looking out for their best interests and they have psychological safety, it creates much more of a trusting environment. Look and see what kind of benefits you already have. Ask and push on your benefit providers what could be done, especially in the mental health employee assistance area. Your work capacity and stress management. Sure, we're all stressed, and the capacity is going to continue to be an issue as even surges come about. And then celebrate. Boy, you've done some things that if you actually took the time and a breather, you could be very proud about. But celebrate those that are on the front line if you haven't already, and let the organization know how important they are to your success. Now's the time to really do that. And then finally, we don't have time to go through it in detail, but look, this is when bad actors come out of the woodwork. This is what they love, is the opportunity to prey when people's guard are down or focus somewhere else. Make sure you know who you're doing business with. Make sure that if they claim to be a charity or a nonprofit, that they are. Ask for their tax identification number, check that they qualify. Make sure they're a real company. I believe you're going to start to see, and there have already been OIG enforcements and Department of Justice prosecutions of bad actors claiming to offer things and they don't actually exist or they're false. So check out their website, do some diligence. Don't just be happy that you found somebody on the internet and then hope that they are who they say they are. Unsolicited emails are probably your biggest key. Kind of, if you don't already have a relationship with them, an extra flag goes up. Don't open up or click on email links that you're not familiar with, as it may create malware in your system, etc. So not trying to scare you, but just be careful, be diligent. And now, Donna, back to you.
Thanks, Mike. So as we wrap up today, we just want to talk about a couple of things. So first and foremost, what we started with, we'll end with, right? Collaboration and communication. Whether it's collaboration between HR and compliance, whether it's collaboration and communication with your COVID team, how we're communicating, making sure that each day that we are clearly communicating and supporting each other through this COVID process, we think is absolutely vital. Certainly making sure that your teams have tools and resources that they need. Again, those may be as clear and defined as PPE, but it may be the mental health support that they need in order to do their jobs. Certainly being agile and flexible. I'm sure that each one of us comes into our day with a goal and a plan of how we're going to execute the day. And by 9 or 10, if we're lucky, that day has already drastically changed, whether it's a change or new communication from CMS, or whether it's a change in something within your healthcare organization. We all have to be agile and flexible as we try to meet the needs. And then last on this particular slide, really beginning to plan for your approach for post-COVID. I don't even know what post-COVID means right now, but certainly as the next wave or the next phase, as our individual states are making decisions on how they're going to, quote, reopen, what does that mean to us in the healthcare world? And does it mean an increase in COVID exposure? Does it mean an increase in exposure to our employees because they're now going to a restaurant or to an event? And just really beginning to think about what does that look like as we begin towards the next phase. The next thing we want to talk about just quickly is that concept again of the different waves, right? Excuse me. The statement, when, you know, what gets taken apart must be put back together. I think when we put things back together, they will look significantly different than they do today. So really taking inventory of our team members. What worked? What didn't work? Did we have the right configuration? Do we have the right number of nurses versus nursing assistants? Did we have enough housekeeping staff? Do we have enough laundry staff? Like really understanding the inventory of our teams. Do we have enough administrative staff to manage the phones when we're trying to call all the family members who are inquiring about the patients and their, the loved ones that we're caring for? How are you addressing the burnout, the stress that our staff are feeling? What worked? What didn't work? What should we be doing differently? What are we going to hire differently? Kind of goes with that number one, inventory, right? What are we missing as we look at how well we met the need? Are we communicating on the front lines? Are we surveying our teams when we have a little bit of a lull to ask them how they felt about the communication and the support over or as we look back over the last 8 weeks or so? Do we have a coordinated plan especially for those folks who are in the hospital systems or the health systems where they've had a decline in census and we've had to stop a lot of the elective services? What does that look like to turn that back on, or how could we manage that differently in the next wave? Do we have the right tools and partnerships? Do we have the right vendor partners? Have we been working with the right people that really helped us keep our business moving forward and take care of the patients? Are we proactively combating fraud, waste, and abuse? As we look at, Mike's talking about the fraudsters that are coming out of the woodwork right now, are we prepared to make sure that our staff don't fall prey to any of those things? And then really, how are we going to communicate through each phase, and what are those expectations, and how are we going to really make sure people are clear on what the next wave looks like? And for those of us who are working remotely now, what does it look and feel like to come back into an office setting, and are people comfortable doing that? So lots of questions, lots to think about as we move forward. So let's close with some good news, right? The bright side is I think we have learned a lot. I think we are hopefully going to impact things in positive ways. I think whether you're a sports-minded person or not, healthcare is a team sport, right? Everyone is making a difference. Mike talked about the focus on our clinicians as the heroes. And the truth is, everyone in the healthcare organization is a hero. The vendors that are supporting you are heroes. Those of you that are making those really difficult decisions on whether people are coming to work or not coming to work, you are the heroes. We are a team sport. Everyone's going to, by working together, allow us to successfully get out of this current phase. There are a record number of people that are really, truly trying to volunteer and help in the hotspots. Lots of folks are trying to donate blood or plasma. Telehealth and telemedicine, right, are just popping up as fast as they possibly can. Practitioners who have been retired who still want to help are coming in through telehealth and telemedicine to provide support in areas where there might not have been enough clinicians. Behavioral health, for an example, where there really aren't enough behavioral specialists in any community to support the current need. Awareness throughout the country of the minority populations and the disparity in our healthcare coverage and the quality of the care. I think just growing that awareness is going to help us as we plan going forward. The future impacts that we talked about, right? Are we going to manage influenza next year better and smarter, because now the general population understands why washing our hands is so important, and just common sense practices that maybe we just took for granted. Hopefully there's some reduction in barriers for some trials and new treatments going forward. As we're looking at the electronic health record and the interaction of data moving faster than ever between health systems, are we creating a better communication tool? And what are the other potential barriers that we're knocking down? We've certainly seen a lax in the licensure requirements, right? We're allowing clinicians to work in different states much more easily than we did before. So those, I hope, we all believe are good news, good sides to COVID. This is a difficult time for all of us, and trying to find the positives, I think is really important. Each day, trying to celebrate one positive will, I believe, make your day go a little bit better. So with that, we truly want to say thank you again for taking time with the Provider Trust team, sharing your perspectives. Matt always asks that you share your ideas with us for future webinars. We love hearing from you. Anything that Provider Trust can do to help support you in this time. We too are trying to be agile and flexible, making sure that we meet not only our clients' needs, but all of the healthcare population. So on behalf of Mike and Matt and I, be safe and be well.
Thank you, Donna. And please be on the lookout this afternoon for that follow-up. This presentation will come to you in PDF form where all those links that you saw today will be clickable. So you'll be able to get to those resources easily. And as Donna said, just thanks again for joining us, choosing to spend your time with Provider Trust today. We hope that you guys have a great rest of the week.